Hi, I'm just waiting at Dublin Airport and on my way over to London for the ACE conference over the next few days, and really thrilled to be meeting colleagues and see what's happening in the aesthetic field. And I'll be doing some talks and demonstrations myself. One question I've had recently is, how can you slim the face over time? In a nutshell, what's happening is the skin is getting more lax and sagging down. The fat pads superficially are sliding down. The muscle in the lower face is getting more active and pulling down the face and making the jawline and chin less distinct, and the bone underneath here is shrinking, providing less support. A couple of things you can do. If I look at my face when I was younger and everything was a nice V shape like this, over time what happens then is it starts to change shape and get more saggy at the bottom. Things you can do, number one, is improve your skin quality, and that's really good ingredients, simple ones like SPF, retinol and vitamin C, and they'll help protect the skin. You can use products like dermal fillers deep on the bone here to help get some lift like that. It's a subtle lift, but it makes a difference. And you can also lift here. So we're not trying to do this, we're trying to do this. So definitely you can do those things to improve. If somebody's got a really active masseter muscle here, and they may be a tooth grinder, they may get ache in the jaw, and that muscle can hypertrophy or grow larger and it gets bulkier, and in some people we'll see quite a wide jawline here. And women, we want an oval shape. Men, we want a more square up and down, where the width of the jaw and the width of the cheek here are similar, but in women we want the width of the jaw to be slimmer and more feminine. So you can, in some people, if they have lots of activity going on in this masseter muscle, you can use botulinum toxin to slim that muscle. It takes about a month to work, and there are two reasons we might do that. One is functional issues. So if you've got pain, teeth grinding, if you've got ache, if you are wearing down a retainer. And the second is if you feel there's an aesthetic component to it and you want to slim the face and improve the appearance. So that's an option to slim. The other thing we do is sometimes first is we're trying to lift as much as we can, and then we're trying to sculpt. And where we get this pre-jowl sulcus here, where things are sliding down and their ligaments halting its complete slide down, we'll often put structural dermal fillers or collagen stimulator injections along the jawline here. So first is lift, and the second is create the illusion of a slimmer jawline. And often that'll help improve a double chin as well. You can do things like radiofrequency microneedling itself, like skin pen. You can use laser devices. All of those will give a small amount of tightening, but we really don't want to overpromise treatments. And when somebody comes into me and says, can you get rid of this and get rid of that and get rid of this, I always say, look, I prefer the words improve, freshen, soften, rather than get rid of, because our faces are really complex and we want to give natural results. You can also do botulinum toxin in this muscle here, depressor anguli oris, which pulls the mouth down over time, and you can do some in the mentalis muscle here. That pulls the chin up. I've treated mine and that has become more relaxed. Also along the jawline, the platysma muscle here is pulling down, and you can do two little lines of very superficial injections with botulinum toxin, and do seek a medical provider for that who's adequately trained and experienced. And then for what we call platysmal bands, you can actually treat these bands separately as well, because they're pulling down. So I try not to make that face too much, but even when I'm chewing, sometimes I can see those getting really active, and they're just little gristly bands from the platysma muscles, which start, they insert here on the chin, they come all the way down to past the collarbones, and basically most of it pulls down. So anything we're doing to stop it pulling down, you'll get a little lift as well. So when you're treating with botulinum toxin, you're always looking at what's the effect you want to get. So muscles will only pull, they can't push, and they will pull back towards their origin. And if we put botulinum toxin in a muscle, you'll weaken it or quieten it for a few months. And if you want to lift a muscle, we weaken the corresponding opposite muscle that's pulling in it the other direction. So it's like a tug of war. If I want to lift the brows, I weaken the depressing muscles here in the frown lines and the outer corner of the eye muscle here, the orbicularis oculi. And if I want to stop the pull and pursing of the lips, I'll do some treatment there. So really nice, fascinating, complex. The reason why men age better often is because that little bit of sagging actually looks and makes them more square. And in men who want to have a more square jawline, you can put some dermal filler products or collagen stimulator injectables. along the jawline and contour as well. So I hope that's helpful. Feel free to get in touch if you have any questions. Take care. Bye.